Diabetes and edema. Diabetes and macular edema. Macular edema is a condition in which the macular tissue area near the center of the retina gets filled with fluid. This area is mainly responsible for vision. Macular edema caused from diabetic retinopathy is a complication of diabetes. The vision loss can progress, leading to eventual blindness. Diabetes and pulmonary edema. Pulmonary edema may be caused due to cardiovascular disease and complications or use of diabetic medications. According to September 2001 issue of the Mayo Clinic Proceedings, pulmonary edema treatment involves placing a catheter to drain the fluids. Diabetes and edema in the feet and legs. Foot and leg edema may be caused by cardiovascular disease, venous insufficiency, liver conditions, cardiomyopathy, or kidney complications. This condition may increase the already high risk of non-healing wounds for people with diabetes. Treatment includes manual decongestive therapy and diuretics, which drains fluids out of the affected areas. Treatment for edema and diabetes. Massage. Manual lymphatic drainage is a massive technique that is best done by professional therapists. Each session of the therapeutic massage begins by raising and supporting the affected limb above the level of the heart for 10 to 15 minutes. When properly done, manual lymphatic drainage follows the map of the lymphatic system in the affected limb. The aim is to return the fluids pooling in the limbs back to the lymph nodes in the groin area. Diuretics. Diuretics are also effective in treating edema patients. There are three classes of diuretics: loop diuretics, thiazide diuretics, and potassium-sparing diuretics. Thiazide diuretics are effective, but they are not recommended for diabetic patients. This is because thiazides affect the ability of the body to maintain optimal glucose control. Therapy with potassium-sparing diuretics should be avoided, if possible, in patients with diabetes, especially uncontrolled or insulin-dependent diabetes mellitus. If these drugs are used, serum potassium levels and renal function should be monitored at regular intervals. Products like Capacet use natural diuretics like dandelion may be a better option for diabetics. Compression products. Compression stockings, gloves, bandages, sleeves, and garments may be helpful to reduce swelling from edema. The general principle of compression wear is to provide sufficient pressure on the body part affected by the edema. This encourages blood circulation and the return of fluids into the lymphatic system. Exercise. Exercise is also important for treating edema complicated with diabetes. Short, regular aerobic exercises are the ideal. Exercise helps the muscles to flex and blood circulation to resume. This prevents more fluids from pooling in the extracellular spaces and force the fluids retained to be redistributed to the lymphatic system for emptying. Learn more at www.progressivehealth.com/edema-diabetes.htm.